I think that when we say, a person's on TRT, and like if they go to their primary and or any other provider and they say, oh, you're being treated just for low testosterone, it's really not really encompassing or capturing really what we're doing, in this space. Because you know testosterone replacement therapy, it's so beneficial, not just of getting your testosterone on the optimal level, but what it does to the body as far as improving your cognition, as far as brain fog, low memory, improving your memory, improving your motivation. And I think that it should be like relabeled as like metabolic enhancement therapy or whatever. I said a fancier term on another podcast I was on, or another discussion, because I think that what it's really doing is helping prevent and reverse, you know, people's very poor metabolism, and improving and like getting people off of a lot of their medications. I mean, I've weaned probably close to 1,000 men off of hypertensive, blood pressure medications. So I mean, I said this in a video on my social media page, but if there was one treatment that I would give patients, men and women, to help get them off of pre-diabetic medication, diabetic, type 2 diabetic medication, blood pressure medication, improve their sex life and overall motivation, and I call it mental resilience, not just depression, but the ability to tolerate stressful situations. It would be hormone replacement therapy for both men and women. I mean, there's very few either pharmaceutical or hormonal or supplements that really can cure or and improve like multiple aspects of health. There's really not many that do that besides hormone replacement therapy.